Hi, my name is Dr. Rob DeBeese, and I wanted to welcome you here today to another one of Dr. Rob's whiteboard sessions. Now today we're going to be discussing the 6 warning signs that a person may be pre-diabetic. The first one that we're going to talk about is blurry vision. When a person's sugar starts to get too high and then drop and then get high and drop, almost like a roller coaster effect that sometimes occurs in the pre-diabetic patient, that affects the eyes. It affects the ability of the eyes to focus. So a person might notice that their eyes are blurry and other times they're not. They might have periods where they're at work and they're looking at a piece of paper and they think, oh geez, that's a little blurry, and they might just chalk it up to themselves being tired or overworked that particular day. So just be attention to that one. The second one that we're going to look at is excessive thirst. When the sugar levels start to become too high in your bloodstream, your body's natural response is to want to flush the excess sugar out through the kidneys. The body needs water in order to flush the excess sugar out through the kidneys, so you will start to crave water in the attempt of the body to regulate itself and reduce the blood sugar. The third one we're going to talk about are wounds and infections that are not healing properly. Meaning you get a cut and you notice, wow, I've had this cut for several days and it's still not fully healed. Or you notice you're bruising more easily, or the bruises are not going away. If you're a woman, one of the telltale signs is chronic UTIs, so chronic urinary tract infections that you always seem to have to be treating, chronic vaginal infections like yeast infections that you always seem to be treating, as well as sometimes infections of the skin, like boils, sometimes that'll develop under the breast, or other types of sores and things like that. The next one is fatigue. One of the problems in the pre-diabetic patient is there's a lot of sugar in the blood, but the sugar can't make it into the cell. And that's where our body gets the energy from. Your body takes the sugar from the blood, brings it into the cell, and there's a little energy production plant inside of your cell called the mitochondria that then generates energy, and then we have energy. In the pre-diabetic patient, there's too much sugar in the blood, not enough sugar in the cell, so as a result, you could be extremely tired. Especially after moments of eating. If you eat like a little bit too big of a meal, you might notice crashes, afternoon crashes after lunch, dinner crashes. The next one we're going to talk about is weight gain. So why would this person gain weight? Well, because if there's too much sugar in the blood, your body has to elevate the most powerful fat-storing hormone that it has, which is called insulin. And insulin is going to shut off your ability to burn fat, and it's going to cause you to store fat. The last one we're going to talk about is dark areas in the skin that typically develop like in the neck or under the armpit or in the elbow creases. One of the things that happens in the pre-diabetic case is their insulin is often higher than it should be. And insulin causes the skin cells of your body to overproduce more quickly, meaning they reproduce more rapidly. And when that happens, they become dark. You get a darkening in that area. Typically around the neck, back of the neck, underarm area, anywhere you have a crease like in the elbows and things like that. So these are the 6 most common signs that a person may be moving into or is pre-diabetic. If you have any of these signs, please consult your doctor. Get yourself checked out. Most of the time when you look at pre-diabetics, there's a lot that can be done through diet, through exercise, and through nutrition. So make sure when you talk to your doctor that you're looking in those areas. If you liked what you heard today, please subscribe to our channel. My purpose here is to help, and I want to educate and help as many people as I can. If there's someone you know that you think would benefit from this channel, please share me with them. I'm happy to help, and I want to reach people. Thanks very much. Have a great and a healthy day.